What kind of questions and concerns do you guys personally have about the COVID vaccine? Have you been vaccinated? What was it like? Maybe we could start there.
Well, we were vaccinated on Tuesday, 2 days ago.
Wow, your first vaccine.
Yes.
Mhm.
So our second one will be coming.
Congratulations.
Yeah, thank you. Our second one will be coming in approximately 21 days.
Right.
So, uh,
So you guys must have gotten the Pfizer vaccine.
yes.
Great. And did both of you guys receive it on Tuesday?
I did not.
You did not. And tell us more, Jessica.
Um, I I just didn't yet. Not that I am opposed to it or won't get it. I just haven't yet.
So I just want to be clear, and I bring absolutely no judgment in any of these matters. My job as a physician is always to advise what I know, and then for individuals to make their own decisions based on that information. Were you offered the vaccine on Tuesday and you decided you felt like you wanted to wait a bit longer before getting it? Yeah.
Correct. Yep.
Would you be comfortable sharing with us a little bit about what specific things are motivating you to wait longer to get it?
I guess one is it's not required for
Mhm.
anything yet.
Yep.
I know there's been little talk that it might be required to like get on an airplane to travel, possibly at our workplace in the future, I guess. I'm not sure. Um, that for one. I've heard some people, mostly younger people that I work with too, saying that it could cause infertility. I guess I haven't really done any background research, but I just thought I would hold off for a little while, I guess.
Yeah. I can say that the concern about infertility is very, it's a widespread misbelief. There's absolutely no evidence that either infection with COVID-19 or vaccination against COVID-19 causes infertility. There was a hypothetical concern that was raised by a researcher a few months ago, and absolutely that has not been borne out in the evidence whatsoever. Um, and so I always try to allay people's fears that certainly there is no evidence and there's really no basis to believe that the vaccine or infection with COVID-19 itself could cause infertility either among men or among women. Um, is that something you had heard, that there's really no evidence to support that?
Yeah.
Yeah, okay, good. What other concerns have you guys heard or do you personally have about the vaccine?
Uh, some of the things that we've heard in the prison, there are people that are afraid because they don't believe it has been tested enough.
Yeah.
There's of course the conspiracy theories that there's microchips in it and and that and it will change our DNA.
Let's pause there because I want to break
Sure.
down some of those a little bit more. Thank you, Dan, for offering those. I think one piece of information that I really wanted to share with you both, and even with you, Kevin, if you haven't read about this particular news yet, is that this week was actually a humongous piece of news for the COVID vaccine. As you guys both know, the original trials for the Pfizer vaccine were a few tens of thousands of people. But this week, we got the first real life data back from the nation of Israel, where they have done a tremendous job vaccinating a huge proportion of their population. And they released this week in a study results from 597,000 people who were vaccinated, actually with the same vaccine that you guys were offered, the Pfizer vaccine. I got the Moderna vaccine. That's just what was being offered at the hospital where I work on the day that I got the vaccine. And this huge study, again, of almost 600,000 people in Israel, showed almost identical efficacy as what they found in the original trial, meaning there was a 94% reduction in kind of overall COVID-19 infection. So in terms of the efficacy and the safety, this is like huge news because it's so many people who are involved in this study. So I think that's going to be the next piece, is really getting word out about this humongous study out of Israel. And I think it's very common, or I definitely have heard, and we receive letters from people who live in prison, and of course I also hear concerns from my own patients, and they say, well, this vaccine was developed so fast. I thought developing a vaccine takes years. How could it possibly be safe? Is that kind of the type of thinking that you guys have been hearing, either from people who work in the prison or live in the prison? Yeah.
Yes.
And it's really understandable, because how could it have been developed so quickly? And the sad thing there is that part of the reason that they were able to get enough data so soon is that the outbreaks of COVID-19 in the United States have been so severe that they were able to achieve the necessary number of cases much faster, actually, than was originally anticipated. And because so many people were exposed to and actually got COVID-19 earlier than what they thought in the trial, because the outbreak was so much worse, that's how we ended up with the data so soon. And the data, I will also point out, from the original trials of both the Pfizer and Moderna vaccines, those studies were conducted the exact same way as any other vaccine. I always point to the example of the HPV vaccine, which is another relatively new vaccine, which actually contained fewer participants than either the Pfizer or Moderna trials. So I would love for you guys to also get the word out that these were the exact same trials that would be done for any new vaccine in the United States. There was no difference in the type of trial. We also get so many questions about, in particular, not only is this safe because it was developed so fast, but two, is it safe because this is a brand new technology, at least in the sense that this is the first time we're having a huge campaign where literally millions and millions of people are being vaccinated using this new technology. And I have read extensively, as most doctors have had to become experts in this area. And mRNA technology, so mRNA vaccines, it's a special kind of new technology to make a vaccine, where normally when you get a vaccine, you actually get a little tiny part of the vaccine somehow injected into you, and then your body responds to that little part of the virus in order to make you immune. But in the case of the mRNA vaccine, there's actually no part of the COVID-19 virus itself. It's only like the plans for how to identify the outside of the COVID-19 virus. And they have been working on this technology for more than a decade. And then as soon as they realized that the SARS-CoV-2, which is the name of the virus that causes COVID-19, might be a great target, believe it or not, they actually started trying to make an mRNA vaccine in January of 2020. So they first started working on this now 13 months ago. So way before, we didn't have any type of physical distancing or masks or anything until March. So even 2 months before that, actually researchers in the United States were trying to figure out how to use this technology, which they had been working on for a decade, to specifically attack COVID-19. And I really relate to people's fears, and actually knowing well the science. To me, I actually feel safer knowing that there's no part of COVID-19 that's being injected into me. It's only the plans for how to make COVID-19. Yeah, just wanted to sort of share that fact with you all, that in fact this has been in the works for a decade.
That is one of the things that mRNA and the DNA, uh, there's a lot of uh, I, misunderstanding about the two and how it could cause issues. And so it that's a good thing to clear up to understand it better.
Yeah, I of course work at a hospital, and I ask people all the time who I work with, well, are you planning to get the vaccine? And actually, a social worker who I work with said, no, I think it's too new, and I'm really worried that it could change my DNA. And I kind of, explained everything to her about how there's no possible way. mRNA is completely different. It does not cause your DNA to change. There's no possible mechanism for that to happen. And I must say, it's just really hard because people's beliefs about this are very deeply held. We, at the end of that conversation, she still felt like, I'm really not sure about the vaccine. I haven't followed up with her to find out if she actually ended up getting it or not, because it's a very individual decision. Yeah. Jessica, I'm wondering where you're at after sort of hearing everything that I have to say over the last, 20, 25 minutes or so.
I guess, I mean, and from this and from just being at that testing event where we were offered the vaccine, I probably should have just got it. And I don't know if when they offer the second dose, if they're going to re-offer the first. I don't know if it's the same or different, but I would probably get it.
I want to just answer the factual portion of that question. It actually is the same. Like the vial is the same, whether you're getting the first or second dose. The way your body responds to it is different, whether it's the first or second dose. And in fact, actually, we don't know for sure, but we think even the way your body responds to it is a little bit different if you've actually had COVID-19. And in a good way. If you've had COVID-19 before, there's some newer evidence that possibly you have a lot of protection after only one dose of the vaccine. Whereas, like for me, I've never had COVID-19, and we know that for people like me, you really need 2 doses to get maximum and long-lasting protection from all different parts of your immune system. The second dose really kind of activates more like the less commonly used parts of the immune system are trained by that second dose. But very often I hear from people who didn't take the vaccine when it was first offered. They're like, oh, now I wish I would have, because I don't know when I'm going to be offered it again. And that's particularly true in the prison setting, where in most states, and you guys can tell me if you know what it's like in North Dakota, or Kevin, I don't know if you know, I have to be honest, I know the most about California where Kevin and I live. In most states, prisons have really had to fight to get early access to the vaccine, and the vaccine is in very short supply. And so I really try to encourage people, if you get offered the vaccine, take it, because there is just no guarantee exactly when you're going to be offered it again. You will be offered it again, but it could be as long as months before you're re-offered it. But I'm really glad to hear that you do plan to get it now, and hopefully they will have enough doses set aside to do more first vaccination when they come around to do the second vaccination in a few weeks. Kevin, I know you've talked to a lot of correctional officers because you work so much with our COs, and I'm wondering what else you've heard from them in terms of concerns or fears about the COVID vaccine.
So I think the really main ones are what Dan's expressed, that was developed kind of quickly. What I haven't heard so much though, and I think it's interesting, Jessica, that you brought up today, was the infertility perspective. And I haven't seen very much information addressed on that, but I imagine that if we're speaking about it, there's probably other concerns from other people. So just for my own personal education, thank you for sort of bringing that up to broaden my view. I don't know. I think that there's concerns with how someone's going to react from receiving the vaccine. Like, hey, I'm going, like you said, hey, I'll get the vaccine. I don't want to be sick. I'll just get COVID instead, and I won't even have to worry about the vaccine part of things. Is that something that Jessica or Dan, you've heard or seen around or anything?
Yeah, a little bit about it. I've never had it, so that really wasn't one of my personal concerns, I guess. But I work with somebody that their spouse had gotten the vaccine and they had had COVID prior, and they got really sick. Like they didn't even know they had COVID. Like they tested positive, they didn't have any side effects or any symptoms or anything, and then they had received a vaccine and gotten sick. So I don't know if that person chose to get it or not, but I know that that was one of their concerns.
Leah, I don't know if you could speak to that at all of.
Yeah, I mean, I think it's really important to set expectations, and part of why I want to educate you guys is so that you can educate the prison residents whenever they're getting their second doses. Some people definitely will feel sick after the first dose. It's common, particularly it's common to have muscle pain and soreness on the side where you got the vaccine, A few people have fever, chills for 24 to 48 hours after the vaccine first dose. After the second dose, it's much more common to actually have chills, to have body aches, to have worse pain even in the arm than you did after the first dose. And then there's a small proportion of people, less than 20% of vaccine recipients actually will have a fever after the second dose. I will share that I was in that unlucky category of the less than 20% of people. I actually had a fever of 101.4 after about 14 hours after my second dose. So I got the dose of the vaccine at 12:15, like middle of the day. It was between my morning and afternoon clinics. And then by like 1 or 2 a.m., I felt really actually quite sick. I had a fever, I had chills, my whole body hurt, I was sweating. And the actually, this I don't know if everyone will feel this way, but I know it's common among healthcare providers to feel this way. I felt really happy because I knew that it meant that my body was really preparing to fight off the COVID-19 virus should I ever be exposed to it in the future. So these, we almost don't even like to use the word side effects because these are anticipated symptoms of responding appropriately to a vaccine and the way that your body responds when your immune system is being trained by a vaccine, what to do in case it encounters the virus in the future. So certainly these side effects are very common and they should not last more than 48 hours after the vaccine. The policy at the hospital where I work is that if you still feel sick more than 48 hours after you got either the first or second dose of the vaccine, actually you should get tested for COVID-19 because it's possible that you could actually be sick with COVID-19. And of course, we would want to know right away. And I just want to point out as a second question, the vaccine itself cannot make you test positive for COVID-19. Because of how it works, it's impossible to test positive for COVID-19 because of the vaccine itself. If you test positive for COVID-19 after you got the vaccine, it's because you have COVID-19 and contracted it, from someone you were near at the grocery store, at work, wherever. Questions about any of that information?
I think so. With my arm, having the shot 2 days ago, yesterday I had some minor soreness. I have nothing today. So that's much better than the normal flu shot. Uh, my wife, her symptoms sounded very close to what you had, Leah. She's had her second. Um, we She didn't feel sick until the next morning or about 24 hours later. And then she felt nauseous for most of the day while she was at work. When she got home, she ended up with a fever. And about 4 hours later, that broke. She went to bed. And the next morning when she got up, she said she felt fabulous. So she was ready to head back to work. So she didn't miss any work. But it we'll see what it does for me on the second round too. It'll be interesting.
That's a very, common experience, what I had and what your wife went through, Dan. And again, we just want to keep spreading the word that if you feel sick, either after the first or second dose, as long as it's only within the first 48 hours at the vaccine, that's normal. And we expect that. And it actually shows us that the vaccine is working to help protect you from getting sick in the future. Yeah.
We've got one lieutenant here that had COVID-19 and he did have his vaccination also. His purpose was, he said, as bad as having COVID-19, he said, if there's any reason or any way that I won't get it again, I'll take the shot. Because he struggled. He struggled quite a bit.
I'm sorry to hear that. And I think, from my perspective as a doctor, these vaccines are nothing short of miracles, that they're so effective, that they're so safe, that we got them so quickly. And now, of course, we just need many more. We need millions and millions more of the vaccines so we can make sure as many people are vaccinated as possible. And then we need more data about the safety and efficacy of giving these vaccines to children, because that's actually going to be the next kind of big round of vaccination once all adults in the United States are vaccinated.